So Gauteng remains the province hardest hit by the coronavirus crisis, with the health department in the province doing everything it can to get a handle on the extent of the pandemic. Just yesterday, Cooperative Governance Minister Dr. Zuma suggested that the country's worst affected areas could remain in hard lockdown while restrictions are phased out elsewhere. Joining us for an update on the province's efforts to combat COVID-19 is the Gauteng Health Department spokesperson, Kwara Kekana. Kwara, thanks very much for your time. Welcome to Newsroom Africa. So we're sort of seeing, about 500 or so patients having had recovered, 6,000 contacts haven't been reached, those who've been in contact with people who've tested positive. Give us an update perhaps as a start on the capacity that the provincial health department still has to deal with the increasing number of patients.
So the one thing is we are, and this is something that the president had indicated, that provinces need to start upping their game with regards to the screening and the testing, especially in communities and especially in high-risk areas. And as I think towards the end of March, the Gauteng province, as you'd remember, we started in particular in Alexandra township. Remember, we had that one confirmed case in Alex at the time, and we then dispatched a team of district health services team from Johannesburg, which also MEC Ayanda Nyathi joined, and the Premier at the time, to conduct community screenings and testing as well. And of course, that program has been ongoing in various districts. As yesterday, as I was listening to the inset as well, yesterday there was a community screening campaign and testing in Lenasia South in Hospital Hill. Of course, this effort is also supported by the National Health Laboratory Services. You remember the minister launched a couple of mobile trucks with NHLS a couple of weeks ago. So that effort is also supported by the NHLS through their mobile labs that do assist us when we go into these communities.
Yes, Kwara? Kwara, are you still there?
Yes, I'm here.
All right. I thought we had lost you there for some reason. We're also getting reports of, an officer at the Johannesburg Johannesburg Correctional Services facility who had tested positive, but whose whereabouts are not known. Are you able to confirm this for us? And if so, how much do you know about where he is?
I'm not familiar with the story, and we will take it up with the team from Correctional Services. But what has been happening with regards to correctional service facilities in Gauteng is that we are treating, of course, the correctional services as a 6th district. So we have 5 districts in Gauteng, traditionally, so that is Ekurhuleni, Western, Sidibeng, Tshwane, Johannesburg, and the Western, of course. We've additionally also added correctional services facilities where, as part of the screening and testing campaigns, we've also now added correctional services facilities, working with, of course, the Department of Correctional Services and Justice, to ensure that there is an intensified campaign of screening and testing, both, the offenders, but also the staff as well as correctional services facilities. This is to ensure that, one, we have a better grip on in terms of the data that's coming out from correctional services facilities, but also in addition to just giving them capacity where they do need it in these various facilities. As you remember, there was some reported cases in those facilities as well. So this is also to make sure that we help prevent the further spread of COVID-19, particularly in the facilities, and to contain the virus where possible.
Right, and just yesterday, as I mentioned, we heard the Cooperative Governance Minister, Dr. Zuma, suggesting a hard lockdown for areas hardest hit by the coronavirus, Gauteng being one of them. Are there any talks of what that might look like if we do get to that stage?
I mean, MEC Ayanda Nyathi, one thing that he has, I think, commented on is the fact that Gauteng in particular has benefited, if you will, from the lockdown, and this has assisted with regards to slowing the rate of transmission of the virus. And of course, you see the value. You'll see that Gauteng is one of the smallest provinces in South Africa. But at the same time, we're seeing the Gauteng being the epicenter of COVID-19 in South Africa. So definitely, with regards to seeing, and this is a conversation that can happen at national level as well, of course, with the input of provincial government. But as far as Gauteng is concerned, the lockdown has assisted us thus far. And so those are different models of what a soft lockdown can look like. That conversation, of course, can happen at a national level, and we'll get guidance from the national leadership with that regard. But as things stand, the lockdown has assisted a bit in Gauteng with slowing down the rate of transmission.
All right. Leave it there at least for now. Thanks very much for that quick update. Kwara Kekana is the spokesperson for the Gauteng Health Department.